Good afternoon. Let us study about the skull. Today's SLOs, anatomical position of the skull. Second SLO, identification and location of the individual bones of the skull. So we are going to study this anatomical position of the skull as well as location and identification of the individual bones in the skull. Anatomical position of the skull is very important with respect to the orientation of the skull, which is very much important to study as well as for the diagnostic therapeutic purpose as well as for the surgeries. For the surgeries or for therapies, diagnostic tools as well as study, it is very much important. Anatomical position of the skull is determined by means of these two lines or two planes. First plane is called as Frankfurt's plane or Frankfurt's line. Second one is called as Reid's line or Reid's base plane. So these are the two planes which are determining the anatomical position of the skull. Let us see this picture. Here we can make it out. These lines. Let us see. This is the orbit. Here we can see the infraorbital margin. So here we can see the infraorbital margin. That first point we have to recognize. Second point is the external acoustic meatus. Superior border of the external acoustic meatus. So these two lines, point A, lower border of the orbit, point B, superior border of the external acoustic meatus. The line or the plane which is passing through these 2 points, A as well as B, that should be a horizontal line. So horizontal line which is passing through the lower border of the orbit and upper border of the external acoustic meatus, that is called as Frankfurt's line, which will be determining the anatomical position of the skull. That is the first one. Second one is Reid's plane or Reid's base line. So let us see this one. First point, we have to determine inferior border of the orbit, lower border of the orbit, point A. Point B is that one, center of the external acoustic meatus. So center of the external acoustic meatus should be connected with the lower border of the orbit or infraorbital margin. So that horizontal line which is passing anteriorly through the infraorbital margin, posteriorly through the center of the external acoustic meatus, that will be determining the anatomical position of the skull as well as it is called as Reid's line. So these are the two lines we have to keep in mind to determine the anatomical position of the skull. After knowing this anatomical position, so we will be getting the clear picture of this orientation of the skull with respect to various uses. Now let us see the identification of individual bones as well as location of those individual bones present in the skull. Here we can see the photograph of the skull. We can make it out the bones. This mass is containing totally 22 bones. That is, skull is the skeleton of the head which is containing 22 bones in total. Among them, some of the bones are protecting the brain and its coverings and supplying vessels, and they are called as neurocranium, bones forming the neurocranium. Totally they are 8 in number. Another set of the bones which are protecting the contents present in the orbit, including the eyeball, and protecting the nose, protecting the oral cavity and its contents. And those bones are called as splanchno-cranium. Those bones are forming the splanchno-cranium and they are 14 in number. So totally it is making 22 bones in the skull. So this is the picture from the lateral aspect of this skull. Let us identify the bones. So this bone is called as the frontal bone, which is present in the anterior aspect. Here is a bone on the posterior aspect called as occipital bone. Then we can see this bone. This is called as parietal bone. So there are two parietal bones, one on the right side, one on the left side. See the right sided parietal bone and this is the left sided parietal bone. This is the anteriorly located frontal bone and this is the posteriorly located occipital bone. Hence, this is the frontal bone, single in number, parietal bone, two are there, right as well as left one, occipital bone, one in number on the posterior aspect. Then we can make it out other bones, like here we can see this bone, it is called as temporal bone. So one temporal bone on the right side, one temporal bone on the left side. On the base of this skull, inferiorly, we are getting here one bone. So this bone is called as the sphenoid bone. So this sphenoid bone is single in number, and one more bone which is present between the sphenoid as well as anteriorly nose, that is called as ethmoid. So these bones together they will make up the neurocranium. So neurocranium is containing the frontal bone, parietal bone, occipital bone, temporal bone, ethmoid bone as well as sphenoid bone. So which are protecting the brain. Totally they are making up the 8 bones. Among them frontal bone, occipital bone, they are single in number. Parietal bones are 2 in number. Temporal bones are 2 in number. Sphenoid and ethmoid they are single in number. Next let us come to the splanchnoscranium. So for the splanchnoscranium we can see this front view of the skull. So here we can see this is called as mandible, single in number. Next here we can see this upper jaw, that is formed by the bone called as maxilla. It is 2 in number, one on the right side, one on the left side. And this is the prominence on the front of the skull, that is called as zygomatic bone, one on the left side, one on the right side. So zygomatic bones are 2 in number, right one and left one. Maxilla forming the upper jaw is 2 in number, right one as well as left one. Mandible is single bone. Then here we can see the nose, which is prominently having the 2 bones on either side of midline. So they are called as right nasal bone as well as left nasal bone. So they are also 2 in number. Further laterally here we are going to get the pair of bone called as lacrimal bone. So lacrimal bones are also 2 in number, as well as the nasal bone, maxilla, zygomatic bones. These are paired bones. Mandible is a single bone. Then vomer, one more bone, so it is a single bone. Then within this lateral wall of this nose is a one individual bone called as inferior nasal concha. They are the paired bones. So these are the bones which are protecting the contents of orbit, including the eyeball, and the organ called as the nose within the nasal cavities, and the oral cavity with its contents. So hence these organs called as splanchnos. So this set of bones which are protecting the nose, protecting the contents of the orbit and protecting the contents of the oral cavity were together called as the splanchnoscranium. So these are together 22 in number. Among them mandible is single bone, as well as mandible and vomer is the single bone, and remaining bones are in pairs on right as well as left side. So this is the picture of the sphenoid bone, which is having the lesser wing. These are the 2 greater wings. Here comes the body of sphenoid bone as well as the pterygoid process. Almost it is having the shape of the bird called as bat. This is the bone called as occipital bone, which is present in the posterior aspect. Hence this neurocranium has the 8 bones: frontal, parietal 2 bones, occipital single bone, temporal 2 bones, ethmoid bone single, sphenoid single bone. Splanchno-cranium, which is protecting the orbit, nose as well as oral cavity and its contents. Let us see. This is the skull. So here we can make it out the orbit. This is the inferior orbital margin. Here is the external acoustic meatus. So if we are connecting this with an horizontal plane, horizontal line like this, so this will be the Frankfurt's line. If you are connecting the point A, infraorbital margin, with the center of the external acoustic meatus, that is this point like this, then that will be called as Wright's line. So these are the two lines which are measuring the anatomical position of the skull. And coming to the location of bones in the skull as well as its names. This is the individual bone called as mandible. So I will keep it inside. This is the bone called as frontal bone on the anterior aspect. This is the bone called as occipital bone. Bone called as occipital bone on the posterior aspect. This is the bone called as the temporal bone on the lateral aspect, on the right side as well as on the left side. And this bone is called as parietal bone, one on the right side, one on the left side. Sphenoid bone, which comes here in the base of the brain, and ethmoid bone, which comes at this internal aspect of this bridge of the nose. So I can show. This bone, this is called as the sphenoid bone. So this is the anterior view of the sphenoid, posterior view of the sphenoid, superior view of the sphenoid as well as inferior view of the sphenoid bone. This is the bone called as parietal bone. This is the bone called as parietal bone with the inner surface as well as outer surface. This is the bone called as temporal bone. So this is the internal aspect of the temporal bone and is the outer aspect of temporal bone, which has the multiple parts. Hence, this is the mass, that is the skeleton of the head called as the skull. Hence, today now we have studied the SLOs. First one, anatomical position of the skull with the two planes, Frankfurt's line or plane along with the Wright's plane. Second SLO, we have studied the identification of individual bones as well as location of the individual bones in the skull, containing neurocranium containing 8 bones as well as splanchno-cranium containing the 14 bones, totally 24 bones in the skull. Thank you.